critical.
So what did I take? It was rose something. I can't remember what it was. But it messed with my liver enzymes. And my
Oh
doctor,
my
she
gosh, was it
called me.
milk thistle? You have to be really
It
careful with
wasn't
milk
milk
thistle.
thistle.
Okay.
I can't remember what it was. But my doctor called me after my annual and was like, you don't drink a lot, do you? I was like, no. And she was like, really strange. Your liver enzymes are up. Are you taking anything else? And so I mentioned these supplements. She goes, stop immediately.
That's a really good point to make. A lot of people think because it's natural, it's a supplement. Supplements can be really dangerous because it's an unregulated market, and so you don't ever know what's in the tab that someone's telling you because it's not a drug, so it's not regulated. And I see a lot of patients. I've seen that happen with milk thistle. People are doing it for a liver detox. The liver is a detoxing organ. We don't need to detox it with other things, right? It's not going to override your liver's capacity to detox itself. But I see all of these different supplements, and it can, have your physician guide your use of these supplements because it can be problematic.
Yeah. So you got to be very careful. You need to let your doctors know what you're doing just in case. And so I was eating raisins. Don't ask, but he said that would help too. So I was
Yeah.
popping raisins every 2 minutes too.
Yeah.
I was out of control.
Yeah.
But I was like, I'm desperate. I need my hair. My mother
Yeah.
said my hair is my crowning glory. I need it.
Yeah. Yeah.
So I think we kind of covered the impact on the mental health of with people and self-esteem with
Yeah.
anyone losing their hair. Yeah,
I
it's
mean,
very.
it's huge, especially for women. Um, your hair is such a critical part of beauty. I see patients that are more depressed in my office over hair loss than into aging and all these, because aging is normal. We all going to age. It's in many ways it's a privilege and a gift. But hair loss doesn't necessarily have to happen with aging. And so when we lose hair, people assume that we're sick, we're not healthy, we're unwell. And so there's a lot of shame around hair loss, right? We blame ourselves, we blame our eating patterns, we blame, 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 blame. And so I find that there's so much shame and blame around hair loss that it's really, really difficult for women. And it's such a big part of we're styling it every day. It communicates so much about us. And so, yeah, there's a lot of women who show up too late for their hair treatments because they've been so ashamed for so long. They've been afraid to even come to their doctor. So you're right. It really affects mental health and mental wellness a lot.
Yeah. So please, like we said, please make sure you go and talk to somebody. If you don't have, excuse me, a dermatologist, then talk to your PCP and get them to refer you to somebody so that you can definitely get in on these medical treatments. Now, can you tell us some of the treatments that you would do for somebody with the different types of hair loss?
Yeah, so if it's just female pattern hair loss, I'm thinking about things that are going to block those hormones because that's a sensitivity to your own male hormones. So things like maybe finasteride if you're a little bit older, DHT blockers. I may try minoxidil. Minoxidil is going to help to increase the circulation on the scalp and improve cellular turnover and get growth. If it's something like CCCA, it's inflammatory. So I'm going to use all those things, but I'm also going to put in, steroids, topical steroids, injectable steroids, oral medications that are anti-inflammatory, because that's all about reducing that inflammation. So things like CCCA are frontal fibrosing alopecia, which is also like losing a band of hair along the front, not due to traction. It's a clean cut. The immune system just makes a clean cut of hair loss. So I'm using all of those anti-inflammatory medications for that. For traction, I may inject some steroids as well. You're hearing a theme. It's all about inflammation. So when you're pulling and tugging the hair, you're creating inflammation. And so that really contributes to the hair loss. So I may inject, I may use PRP, which is platelet-rich plasma. We draw the blood, we spin out those good growth factors from your blood, and we inject that into the scalp. And then if we get to a place where we can't regrow the hair, then I do hair transplant. So once we've reduced the inflammation, if it's a scarring hair loss, or we've done enough treatments that we're like, these follicles have had it, they're not coming back, then we may do a hair transplant, which, these patients are really successful with that.
Yeah, I've seen that on TV and I was like, wow.
Yeah.
That's pretty cool.
Yeah. Patients do really, really well. It's a tedious but safe and well tolerated procedure for everyone.
And I didn't know they were using PRP. PRP they also been using for like knees and joints and stuff too. So that is really cool. But yeah, and then so what do you maybe you don't use, but I know that some people use a laser, some sort of laser treatment for hair loss.
Yeah, so there's a laser I have called the Alma TED. And so it's using these growth factors, and the laser helps to increase the absorption of these growth factors. And so these are the growth factors that our stem cells need to proliferate and create new hair and create more robust hair and create hairs that are denser. So with PRP, we're taking your own growth factors to do that, but we don't know if you have wimpy growth factors. So
Right.
using this helps you take lab made growth factors that are specifically the ones that we want to grow some hair. And so patients come in, they have a treatment monthly for 3 months, and we're seeing really good results with that. And they're thrilled because there are no needles. So patients get exhausted from always having to have needles, needles, needles. Every treatment has a needle. And so this is a painless way to get those growth factors in, stimulate some more hair growth. And patients really have enjoyed it.
So I did have some steroid injections, so I completely understand. But I don't have a problem with needles; it didn't bother me. But can you and I'm thinking about people in my head. Can you do the lasers or any of that, even if the person is a senior citizen?
Yeah, anyone. It's any scalp. The lasers do not discriminate. And if you're an older person, it might be better because as you get older, and if you're a heavy drinker, heavy smoker, those sorts of things, your own personal growth factors are not going to be as effective. And so the lasers may be better for someone who is, a little bit older and may not make the highest quality growth factors.
Got it. Got it. Um, and then besides the traction, which is obviously one way to you can prevent that because so would your thing be just not to wear like if you wear braids, don't wear them too tight that you can't.
Yeah, protective styles are not always protective, right? They're only protective if you're changing them up, if you are making sure there's not too much tension, they're not too tight, that you're still taking care of your hair while you have the styles. Yeah, so and then every protective style doesn't work for everyone. If someone has very thick, very coarse hair, they may be able to maintain a style a little bit longer. Someone with very fine hair cannot, right? And so it's not a one size fits all approach for protective hairstyles.
Yeah, there was a video I just saw today, a reel that talked about how you should not wear locks forever. And everyone was like, what? And I was like, but it makes sense. They get so heavy. And I know people that have lost entire locks because they're just so heavy.
Yeah, exactly. It's just too much weight. The follicles are made to carry the weight that they're programmed to carry, not
Right.
all of the additional weight. And so that can it's damage. Like if you had to hold a 20-pound weight in your hand all day long, your rotator cuff would be ruined, right? Your arm could
Right.
not do it because it's made to carry its own weight, right? And so that's kind of what's happening. We're just damaging those follicles because they're not made to carry all of that weight.
Yeah, so you see, and that they were saying that you shouldn't wear them. You should wear them 10 years and then maybe take them out and take a break or something and try something else or cut them, but you can't,
Yeah, don't make them too heavy if we start
Yeah.
to see hair loss. It's chronic traction when you're retightening or refreshing your locks. Make sure they don't do it too tight. Keep them a little bit looser to make sure that you're not getting too much weight per square area.
Yeah, and there's somebody in the comment here. Yes, my hair is thin out from locks, and I'm thinking about cutting my hair. Well, my locks hurt. Exactly. Yeah. And then the other thing I was thinking about was, it's wonderful. There's so many places you go get your hair braided, but you need to make sure that these people know what they're doing because all of that braiding tension, when you have the wrong person in your head, causes you not a good thing at all. So you need to make certain that you, because that's tension too. So you want to make certain that if you get braids, that they're not too tight.
Exactly.
You should not have to take Tylenol, Aleve, or anything after you get your hair done. You should be just fine. But some people do, and I'm like, even with the sewing, and I was like, no, my hair is never braided so tight that I'm like, oh, I have to go to bed. I have a headache.
You should be able to style your hair immediately. If you get braids, you should be able to pick them up, put them on your head immediately. If it hurts, take it out. Take it out, start over. And I feel for anyone who ever does my braids, because I am really riding them the entire time. Up, too tight, take it out. Too tight, take it out. It could take all day, because it's like, you make that mistake, then you're spending another year growing out this patch of hair that you didn't have to lose, right? So yeah, don't let anyone convince you that they know better for your hair. Oh, it looks fine. If you feel it, it's real, it's tight, take it out, because you'll be the person dealing with that hair loss for the
And
next year.
also, you can see those little bumps come too. Usually, when
Yeah,
it's really, really
that's
tight, you'll get
traction.
little
Yeah,
bumps.
we call that tension folliculitis, and that just means hair loss pending. So if you're seeing that tension folliculitis, absolutely, we need to make sure that you take it out, and that's an emergency.
Yeah. So please, 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 especially the little girls, because it can possibly be a good thing for a 3 or 4 year old to start out with tension alopecia. I don't think so.
Absolutely not. And that happens way too often. A lot of young girls, a lot of people think they inherited their hair loss, and they don't realize it's because, someone, was styling their hair too aggressively. And they're like, well, all the women in my family have this hair loss. It's because everyone in the family has been doing this aggressive styling. And so you can give kids really permanent hair loss before they had a chance. So we want to be really careful with that.
Yeah. So please be careful and mindful, little boys and girls. So
Little
please.
boys and girls, exactly. Little boys are, having fun styling their hair and doing all these cool things now. We want to make sure that we're protecting them, because everyone can really get traction alopecia.
Yeah. Well, thank you so much. This has been very informative. If you have any questions, what is your Instagram? Your Instagram is very easy. It's Dr. Michelle Henry.
Yes, it's Dr.
Yeah.
Michelle Henry. I also do TikTok. I have a fledgling baby TikTok account, and that is Skin Doc Talks. You can find me there.
Hold on, I'm going to put it on the
And then,
screen.
yeah, Skin Doc Talks, or Dr. Michelle Henry on Instagram. And I'm there to answer any questions that you have, anything that you need at all. I'm happy to address. And then, of course, I'd like to
Talks with
see
an S?
Skin Doc Talks.
Yes. Okay. Got it.
TOCTOKS. No, talks, like talk.
Oh,
like TikTok.
gotcha.
Skin Doc Talks.
Gotcha. Okay. Yes. So please check her out there. Check her out on Instagram. She's often on Good Morning America and Today Show with wonderful tidbits of information. We're about to start summer, so I'm sure she'll be talking about sunscreen soon. And yes, Black people should wear sunscreen, right?
Indeed. Don't listen to the rumor saying no. It's for skin cancer prevention, but also to reduce accelerated aging.
Yeah. So you don't want those fine lines, ladies. We don't want crepe skin. We don't all the things.
We don't want crepey skin. We don't want melasma. We don't want sunspots. We don't want dark circles around our eyes. So we don't want hyperpigmentation on the lip. So get SPF in your lip balm. So SPF for beautification and for overall sun protection and safe skin care regimen purposes.
All righty then. Thank you, everyone, and I hope you enjoy the rest of the Women's Summit. Bye.